I remember I was a couple years into my practice and I started working with a man, and he'd moved home with his parents. He was suicidal. He was like, if I can't fix this, like I don't want to be here anymore. You can continue to engage in whatever sex act is happening, penetration, blowjobs, hand jobs, and you just change your breath. And within 3 full breaths, your arousal has dropped to 2 levels. Now that is like PhD level control of your body. So it's actually learning how to breathe into your act. If you were bearing down to go to the bathroom, like pushing out to go to the bathroom, you want just the slightest energy going into the act on the inhale. There is a deep, deep shame around how quickly this is happening. And oftentimes there can be even a turning away from sex and like a pulling back from ever wanting to be intimate at all, because it brings up so much shame and discomfort and embarrassment for them.
Did you know that breathing into your pelvic floor can help you last longer in bed? Or that the porn industry's star ratio is about 7 men to 300 women, and it's warping our understanding of real sex? In today's episode, you'll learn why asking, "Do you like this?" kills intimacy, and what is the connection between anxiety and arousal that's trapping so many men in cycles of shame and premature ejaculation. And lastly, why 15 to 20% of marriages become completely sexless. Welcome back to the Rena Malik MD podcast, your trusted guide for leveling up your health, sex life, and relationships with evidence-based tools. I'm joined by Keeley Rankin, the Washington, D.C. based sex and relationship coach. She's been improving sex lives around the world since 2010. With her master's in counseling psychology and as co-founder of BetterSex.org, she's developed a groundbreaking sex as meditation workshop series and created natural systems that help men overcome everything from premature ejaculation to sexless marriages. If you're here and you've enjoyed this podcast in the past, do me one solid favor. Leave a rating or review on Apple or Spotify. It is completely free and takes just a couple seconds, and it helps us reach more people around the world who can benefit from all this education. And one quick reminder, if you want to learn my top 10 tips for maximizing pleasure, make sure to download the Better Sex, Better Life ebook at www.renamalikmd.com/more pleasure. Now let's get into it with Keeley Rankin. Keeley, thank you so much for joining us today.
Thank you. I'm so delighted to be here.
I'm so excited to talk about so many different things with you. And you are like, I listen to so many of your podcasts on other episodes, and I'm like just really looking forward to this conversation.
Oh, good.
So You've worked on premature ejaculation, stamina, and there are obviously so many myths in this area. What do you think is the single most harmful myth that you've heard that people sort of internalize about this?
I would say actually one of the things that I see people doing the most, that's this myth, is that you can clench and tighten your pelvic floor in order to stop ejaculation. And so what ends up happening is the guys that are struggling with early ejaculation, as they move up their arousal curve, they're tightening their pelvic floor, which is actually just sending them faster up the arousal curve into orgasm. Mm-hmm. And so these cycles, these patterns, they just keep going and going and going, because there's this idea, like if I can just tighten my Kegel muscles or my pelvic floor enough, I can stop the ejaculation from coming out. And then it just creates that system where it goes over and over again.
Well, I think there's some sort of there's some biofeedback, right, that you can do to sort of sort of put the brakes on, right? Because that's what pelvic floor physical therapy does. But I think it's different, right? These people are just like clenching.
Yeah, and there is in the Taoist traditions, they talk about a certain area you can press that would stop the ejaculate, which sends the ejaculate into retrograde, and there's this whole other path over there. Yeah. But the folks that are struggling with early ejaculation mainly need to relax their pelvic floor. I believe if they went and saw a pelvic floor specialist, they would say you're over tightening, and all the time, constantly over tightening, in a state of stress and tightness. Yeah. And so the idea is that we actually don't want to tighten any part of the pelvic floor. We want to learn to be able to relax it and just let it chill out and enjoy the experience versus tightening through the experience.
Right. And I think it's interesting when I see people who sort of are doing a lot of edging, right, which is essentially sort of the same thing almost. Yeah. I find that they also develop a really tight pelvic floor.
Oh, interesting.
Because they're they're tensing
Holding.
to hold,
Right.
and then they start seeing issues in other areas.
Oh,
Like they might
fascinating.
get pain with ejaculation,
Okay.
pain with erections. They might get, sort of urinary frequency, urgency, constipation, those sorts of things,
Fascinating.
because they've now sort of trained their pelvic floor to be
Right.
tense all the time.
Right. That's fascinating.
Yeah.
It's very rare that anybody who's like exploring edging shows up in my office, because I normally have people who are like, I can't come, or my cock doesn't work, or I come too quickly. So I actually don't ever get to really see most of those guys. And that's fascinating to learn, though.
Well, I feel like some of the premature ejaculation or rapid ejaculation patients, they will sort of try to like stop start, right? Which is sort of like edging. It's not exactly the same, but they will try to do some stop start or some squeeze techniques to sort of get them to the point of climax, but not get there, and train their bodies a little bit.
Yes.
How do you feel like that plays into things for patients you see?
Well, I think in general, so when I started working about 15 years ago, and I decided, okay, the reason I ended up in sort of the male dysfunction space is because I didn't feel ready to take on the huge gamut of things that happen around sex for people. And I was like, okay, I'm just going to pick one area to specialize in. And the early ejaculation seemed like, okay, I knew a little bit about it. I had been with a partner very early on who struggled with what I would consider like severe early ejaculation, where the erection almost would go away because there was so much anxiety in the body that he would like either just come right away or not get hard. And so I was like, okay, I think I can work with that. So I went and did all the research I could find and tried to understand it. And the stop-start method is predominantly what therapists were teaching people. It's like, when you get there and you don't want to come, you should just stop. But the problem with that is a lot of times it doesn't actually work. And then people end up feeling like more distraught and ashamed, and like there's no path forward for them. And the other thing that I really dislike about the stop start is there's this disconnection from pleasure, because there's also this like stop and then think about your grandma, right? That's sort of like the joke.
Well, we know that actually doesn't work, right?
It doesn't.
So there's actually good evidence that, especially in men who have premature ejaculation, that it actually is very ineffective. Like 46% of people might see some efficacy, whereas like a regular person, because I think the brain chemistry is slightly different, that in a regular person that does sometimes work. So like if you're talking like a regular person, sometimes it does help because they're just their brain chemistry and things are functioning normally. Whereas like someone who's already struggling, it actually makes it worse sometimes. Yeah,
and what I don't like about it, because what I think about helping folks overcome any sexual area where they're feeling like there's a struggle, my hope for everyone is to more deeply connect with their bodies and to more deeply connect with their pleasure. So if I'm saying like, oh, just think about something else, we're actually now leaving the experience, we're leaving the moment, and we're not fully feeling into the pleasure. So I often really want people to go back into their bodies and back into their pleasure so they can experience that moment in time where things are feeling good, actually.
Yeah. And I think the other thing is you need buy-in from your partner, right? And so it sort of disrupts the flow of things unless you make it into something fun, which it could be.
Yeah, right.
But I think sometimes for a lot of people who've never done anything sort of variant or different in the bedroom, like they find it awkward and uncomfortable. And so people get frustrated and it doesn't always work. And then they're like, well, what else do I have to do?
Yeah, I would say in general that the idea that stop-start is like a thing people should try for early ejaculation is like, it's not where I would recommend people start at all. Again, it's sort of like what is recommended standard protocol of like, if you show up in a therapist's office, they will recommend stop-start. And in my experience, it just doesn't help anybody.
Yeah. So you've made like a 5-step method to help men sort of overcome premature ejaculation. Can you talk a little bit about that?
Yeah, I would love to. Yes. So the first step is breath. So it's learning how to use breath as a tool to help connect with your body and notice what's happening inside of your body. Breath is the most important tool, and it's something that you'll never fully master. It's something you always will return back to. And I normally say, like, you want to be breathing slowly and fully through your mouth, and you're breathing into between a count of 5 to 7 and out to a count of 5 to 7. And this just really helps you drop in and feel what's happening.
And this is during arousal or just in general?
Yes, during arousal, specifically during arousal. And when I talk about how people learn this 5-step method, I really recommend that we start with solo practice, so with masturbation. So you can try and apply this with a partner, and depending sort of where you are in the severity of early ejaculation, it might be helpful. But in general, the most important place is to start with self-pleasure so you can start to learn this practice inside of your body. The second step is the anal breath. So it's actually learning how to breathe into your asshole, which is, if we were going into the pelvic floor specialist place, there's a whole different language for this. But the language that I use when I talk with my clients about it is like the back part of the pelvis. So if you were bearing down to go to the bathroom, like pushing out to go to the bathroom, you want just the slightest energy going into the asshole on the inhale. And that is actually...
So almost like you're having a bowel movement, like you're pushing in that area.
Yes.
While you inhale.
Yes. So you're inhaling and you're pushing out just a tiny bit. And then you're exhaling and letting everything release. So we're doing nothing on the exhale. So the first one is just breathing into the body. The second one is learning the anal breath. And what the anal breath does is allow you to come down the arousal curve. And also when we think about what happens during ejaculation, the pelvic floor tightens, has these involuntary contractions. So a lot of times men who struggle with early ejaculation are already over tightening in that area, which we talked about earlier. And so learning how to soften that area is incredibly important in terms of how we start to relate with our arousal. So the next step, which is step 3, is learning how to separate your arousal curve and your anxiety curve, and learning how to be in your arousal curve.
That is so difficult.
It
right?
Can be very, very difficult, yes.
Because I feel like it is so, especially, so I think there's, just to be clear, there's multiple different types of premature ejaculators, but we typically define them as acquired, meaning it's something new, versus lifelong. And then within acquired, you could talk about sometimes it happens, sometimes it doesn't, variable, things like that. But when you're talking about someone who's acquired it newly, it becomes a huge source of anxiety for them. And then people who've had it lifelong, I mean, some of them learn acceptance, but a lot of them have this anxiety for years around premature ejaculation.
Yeah, absolutely. Yeah. What I noticed with my clients is that as arousal would build, their anxiety would build. So it's almost like their anxiety and their arousal was married together. So if we think of arousal on a scale from 1 to 10, 1 being like, I'd be interested in sex, like we could see where this goes, 9 being the point of a return, and 10 being orgasm. And if we think about that as also an anxiety curve, once you cross over the 5 on the arousal curve, if you cross over the 5 on the anxiety curve, now our system is in a full fight or flight response. It's very difficult to feel pleasure. It's very difficult to relax. And so the nervous system sort of goes into a panic, and then ejaculation just happens right after. And for many men who struggle with that, it's not even a pleasurable experience. Like, I think sometimes there's this idea that like, oh, he's coming quick, he doesn't care about me. And a lot of times the men I've worked with, like, there is a deep shame around how quickly this is happening. And oftentimes there can be even a turning away from sex and like a pulling back from ever wanting to be intimate at all, because it brings up so much shame and discomfort and embarrassment for them.
Yeah.
So if we go back into the step 3 though, and we talk about separating this arousal curve from the anxiety curve, and we talk about how to breathe and stay connected to your body and relaxing your asshole, being able to cruise up and down, which is step 4, which is surfing the sweet spot, moving up and down your arousal curve in a relaxed way allows for that possibility that you're not just going to jump right into that 9 point of no return and the orgasm. So the surfing of the sweet spot goes back into, it's a little confusing, but it goes back into step 2, which is that anal breath. So as you're going up your arousal curve, if you notice, oh, I'm starting to feel a little anxious here, I might jump into my orgasm, you actually change what you're doing, how you're just normally breathing, into the anal breath, and that drops you back down the arousal curve. And when I talk with clients about mastery looks like you can continue to engage in whatever sex act is happening, penetration, blowjobs, hand jobs, and you just change your breath. And within 3 full breaths, your arousal has dropped to 2 levels. Now that is like PhD level control of your body. What it looks like when we start is sometimes men have never actually even come down their arousal curve before. They've only ever gone up.
Yeah.
And so learning how to actively come down, and there's oftentimes a lot of fear in coming down, like if I come down, I'll fly down the arousal curve and I'll never get hard again. And so learning to trust the body and to trust their pleasure and learning how to use that anal breath to drop back down is really is a huge part of that.
Yeah, I think that the hard part that I can imagine is that if your body is so used to going from 1 to 10,
Yes.
right, so quickly that
Right.
you may not even get to the point where you're even like figuring out where 5 is
Right.
might be so
Right.
fast or
Yes.
so sudden.
Yes.
So how do they work towards like one, recognizing that
Yeah.
especially if they're like ejaculating within a minute, let's say, or less
Yeah.
than a minute, right?
Yeah.
And if they are really anxious, how
Yeah.
do they sort of like, so they're like in the moment, they're really excited,
Right.
like how do they kind of manage all this?
Right.
Obviously, you said start with masturbation, but like, how do they sort of
Yeah.
regulate that? Like, I feel like that's
Yeah.
like a huge mountain. Like, step 3 is a
It
huge
is.
mountain to
It's
overcome.
It is. It truly is. Yeah. So I have a course online for people to work through this. And what I say in the course is do not move on to the next module until you can check the list that I have at the bottom that says, I can do these things. And so for some men, if they're struggling with severe early ejaculation, and they are coming really quickly, it can take a really long time. We can be talking like 6 months, 9 months, a year before they feel like they can really separate the arousal curve and enter into arousal where they're relaxed and their bodies are relaxed. It just takes time depending upon like what has gone on in their lives and how they treat sex and how they feel about it, and often how patient they are. Like psychologically, I find folks who struggle with early ejaculation are very impatient. They're go-getters. They get a lot of things done in their life. Like that anxiety is sort of just like threaded throughout their whole nervous system.
Yeah.
And so learning this can be very difficult for people.
They actually looked, there was I think it was a Chinese study where they looked at personality characteristics in association with men who had premature ejaculation. They found that they were less risk takers,
Yeah,
they were more anxious. And so like it may be that there is sort of a personality trait that lends itself to, you know, who knows, chicken or egg that comes first,
Yes.
but maybe it lends itself to being a more rapid ejaculator.
Right. Feeling more anxious, feeling more nervous, feeling like it matters how I perform. Like all of those things contribute. And again, I often say that too with my clients. It's like we talk about what has led to this point, but it's also like now we're here, and it's sort of this self-fulfilling prophecy of like it just builds on itself and builds on itself and builds on itself. And to circle back real quick, so step 5 is one that I think often gets overlooked, but it's all about spreading the energy from the cock, which is the pleasure center of the body, through the rest of the body. So it's not this over focus just on genitals. It's allowing the pleasure to move through the whole system. So we move into an experience that's not just focused on like how hard am I and how long do I last, but actually pleasure centered. And I found that shift for men, when I say like this isn't just about lasting longer so that you don't feel shame or that your partner is satisfied. Like this is truly about your pleasure, owning your pleasure and being able to relax and connect with it. And that makes a really big difference in the framework, I think, that we come into this challenge with.
So let's go back to, sorry, I'm going back to step 3 because I think it's still so difficult to overcome. What are some like actionable tools that you'll give patients to help them sort of understand and like understand their curves and really like get in their headspace with those?
Yeah, absolutely. So mindfulness is a huge component to this. So if I'm working with someone and they've never had a meditation practice, they don't know what mindfulness is, they don't know what a body scan is, we start there. Going back into like, what does it mean to enter into your body and to feel your body? Like if you were to close your eyes, can you feel your big finger? Can you feel your big toe on the left side? Like being able to actually go in and notice what's happening in the body has a lot to do with like how are you going to respond in these moments where you're feeling really anxious and really nervous.
Yeah.
So that's where that breath comes in and becomes so important, is like how do we actually feel into the actual physical body here that we're exploring pleasure with.
And so sort of, I guess in my head, I'm thinking you're delineating, this is what and then when you learn that, you can then, when you're feeling aroused, sort of be like, this is what my body feels like when I'm aroused. I'm, you know, sort of very focused. My senses are heightened. You know, I'm like, whatever I feel, my erection, I feel blood flow, whatever it is.
Right.
And then you can separate that from anxious, like your shoulders tense up, you feel a little bit like on edge, like, those sorts of feelings that you might experience. And so you can sort of separate those two.
Right. The first part is like learning how to relax, then building in arousal and seeing how the system is like tightening as arousal enters. Because like we talked about before, a lot of men will tighten to get hard. The pressure to either stop ejaculation or feeling like they need to get hard really quickly can have a lot to do with it. And so it's like, how do you actually learn how to relax the body? Take a breath, feel what's going on, and then you can start to assess kind of like where things are at. And there is a really big learning process, and everybody's arousal curve looks really different. Like I might say, for instance, I was in the room and I was watching, I might say, you look like you're here, but it might feel different for the person on the inside. And so everybody has to learn, every man would have to learn for themselves, like where are they on the inside? Like where are they on their arousal curve? And I think that's part of like the fun of this journey is like you're learning so much about your body and so much about like what's possible with pleasure.
Yeah. And then I think that the one challenge also is that your brain doesn't really delineate arousal, different types of arousal. And so sometimes anxiety, some of the feelings that you get with anxiety, like your heart racing, you feeling maybe your blood pressure going up, those are also signs that you're aroused. And so it may be also differentiating like, that you can still feel aroused while feeling calm, while calming your body.
Yes. That's a huge component, I feel like, for people who struggle with early ejaculation is that it feels like as the arousal builds, the panic sets in. That's what I often talk to my clients about. It's like there is a feeling of panic, like something's going to go wrong. Either it could be rooted in more historical trauma, like I'm going to get in trouble, or I was caught masturbating at some point as a kid, or somebody said something mean to me during a sexual experience, or, there's all sorts of different reasons why people might feel like they're going to get in, something bad is going to happen to them. But it really is about being able to separate those two things.
I don't take a lot of supplements, but the one I truly believe in is creatine. Creatine helps you increase muscle strength, performance during aerobic exercise, and helps you recover faster after exercise. I recently found a supplement that's combined creatine with some other really beneficial ingredients, including calcium beta-hydroxy beta-methylbutyrate, or HMB, which works synergistically with creatine to enhance the lean muscle benefits, vitamin D, and magnesium L-threonate, which helps with cognition. It's called Creatone, and it's especially formulated by physicians for women. Strong is the new skinny, and Creatone helps you prioritize a lean and sculpted look. Try it today for 20% off your first order. Visit tonetoday.com and use my code RENA for your discount. Again, use my code RENA to save 20% at tonetoday.com. That's TONE today.com.
So step 5 is another one where I'm sort of like, okay, so you, I think that sounds to most men like very like woo-woo. So let's talk a little bit about like what that means, like actionably, like what is that actually, how does one do that?
So sometimes most people will say that that's woo-woo. And it's funny because I'm like the least woo of the community that I'm in. So it's funny, but I can understand how that sounds woo. So if you were to imagine like the pleasure center of your body are your genitals. And although your whole body can carry pleasure, that center carries lots and lots of pleasure. The nerves, everything that's down there. But if you were to imagine almost like in a river or a lake, that there's some dye that goes into the water and it spreads out. That's what we want to think about in terms of what's going on in the arousal. So when the next time someone's in their arousal, and women can do this as well, it's like as you're feeling your pleasure, as you're feeling like, wow, this is feeling really, really good, imagine that it's almost like a drop of dye goes in and it just moves through the whole system. And we want it moving through the inside of the system. So it's like it moves out down your legs, down your knees, into your feet, up your belly, down your arms, into your hands. So it's this idea of like you're consciously putting your attention into the rest of your body. And it's almost like an invitation to the rest of your body to like, hey, come join us here. Like this is a pleasurable experience. Because when full body orgasm comes in, and women tend to be a lot better at finding this on their own, men sometimes need a little bit of help into the full body orgasm. It's like you see when the orgasm happens, the undulation of the whole entire body versus what we often see with men where it's just like, just the ejaculation comes out and not that full orgasm.
Yeah, I think part of it, I suspect part of it is because men are like from a young age sort of groomed into this idea that like orgasm is the most important thing, so they rush to get it and they don't actually like spend time enjoying pleasure, right, as much. They feel like that's the only source of pleasure.
Right. And I think there's also a lot of pressure on men. Like in heterosexual dynamics, it's like you have to get hard under a certain period of time. And often it's like there's a pressure like I should be hard before she reaches for me, which is an incredible amount of pressure, especially as men age, because what turns you on changes, and oftentimes you do need more stimulation, and so you're not going to actually be hard until there's a touch that feels good, as well as you're now supposed to stay hard for a certain period of time, but don't stay hard and not come for too long, because now you're venturing into the delayed orgasm place, which can cause even more struggles in a relationship. So there is also just so much pressure on performance for most men, and there can be this kind of like confusion, like there's not really room for my pleasure here because I'm supposed to act out all of these scripts and perform all of these things and get it all right at the same time.
Yeah, it's a lot of pressure.
Yeah.
And I see it for young boys too, because nowadays I think there's so much more exposure to erotic films and like it's so easily accessible that they don't ever learn the difference between what real sex looks like and what sex looks like on porn. So they show up in my office and like, hey, I think something's wrong with me. And when you delve deeper, you realize that they're comparing their sex to what they saw on pornography, and they're feeling like, oh, she's not orgasming in minutes and I'm not like responding the way that guy does, and so something is wrong with me.
Something's wrong with me.
Yeah,
right.
and
we
it
have
creates
a culture of that. Something's wrong with me.
It creates this horrible environment, you know.
Yeah. Which is why it's so important that we're here doing podcasts like this, and that you're here as a medical doctor saying like, hey, let's talk about pleasure, not just the anatomy of it. So.
Well, I also think what you're doing is so important. I mean, this is an issue, specifically rapid ejaculation, which affects like 30% of men, right? And it's so huge. Many men suffer in silence, and it affects their whole life. Like it's not just in the bedroom; it affects their whole life, and it's such a huge issue. So I think this is really, really important. I do want to ask.
Well, and it's a huge issue too, and I just want to say it often gets joked about like a lot in the media or. One of the, I don't want to scare anyone off from taking the course, but at some point, one of the things I suggest is like, you need to tell someone about this, because most of my clients have not told a soul, not even their doctor. And I remember I was a couple years into my practice and I started working with a man, and he'd moved home with his parents. He was suicidal. He was like, if I can't fix this, like I don't want to be here anymore, because it's just like, what's the point? And so many conversations with men who, they've been flirting with someone at a bar only to just disappear because they're like, what am I going to offer her when we go home? Like, I have nothing to give. Yeah. So it's in our culture, and we just don't talk about it, and people just make jokes about it, versus like genuinely really having a conversation about like, what is pleasure? How do we feel pleasure? What does it mean to be in our bodies? And all of these things. I think it's really important.
Absolutely. Now, I think there's, like I mentioned earlier, there's sort of a distinction between lifelong premature ejaculation and those who acquire it. Do you find that there's a difference in terms of success rates with people who've had it for their whole life? Like, are they sort of, do they struggle a bit more? Do they need additional like pharmacologic help or other options to sort of help them get where they need to go?
So I would say the folks who've never experienced being in, the way I talk about it is like, they've never experienced being in their arousal where they felt like they had a sense of like, I can be here and I know when I'm going to come and I have some choice around it. Those folks tend to take longer in terms of what it means to recover or what it means to feel like they're being successful, just because their nervous system has never actually experienced that. But not always. It just sort of depends where people are. When I work with folks, I try to be as honest as possible. Like, this is what I've seen. This is what it might take. And sometimes it's really heartbreaking to say to someone like, hey, look, I think this is going to take like at least a year. And how do you helps someone find the motivation to keep trying on something that they perceive everyone else just has figured out, which isn't true. I think there's a huge perception that people just have a lot of things figured out in sex. And if you really like dig into it with people, a lot of people don't have anything figured out.
Most people.
They're confused and sort of like, doing what they think could be right, but unless they have a lot of curiosity with their own body or have a partner that's really exploratory and has good communication, a lot of people are they're missing a lot of possibilities for pleasure is the way I think about it.
Yeah. So for someone sitting at home right now, if they wanted to start tonight, they could just start by breathing.
Yes, correct.
Simply the 5-second breath in, breath out, just practicing that even outside of the bedroom and then with themselves during solo sex. Yeah.
So when I talk about the type of breath that I teach, there's the breath into your chest if you're breathing like the upper part of your lungs, moving your ribs. And there's a breath into the belly, the solar plexus. And the breath that I teach is actually the breath down into the pelvis. So it's like an opening of the pelvic floor. So it's a little bit, could be considered a little woo, I guess. But it's this breath where you're deeply bringing your consciousness into that area of our bodies. And for so many people, even if you go into like a mindfulness space like meditation, no one ever mentions the genitals. It's like we do body scans, we go through the whole body, but no one says, and notice what's happening in your genitals. Right? And so it's really this breath of like breathing in and noticing, like what I talk with my clients about is like, notice what's happening with your cock during the day. And a lot of men will report, there's almost like a black box. And I think of that as because, when you're young and you're at school, which most of us were, and you like your teacher calls you or class ends and you have a boner and you have to kind of like tuck it up, you're sort of like, oh my gosh, I wish this would just go away. Like, why is this happening to me? Like, oh my gosh, you really want to hide it. And so I think early on, there's this conditioning to sort of like separate from the genital part of our body. And then suddenly we're like, I want to have sex with this person, like turn it on immediately. And the system is kind of like, I don't know what, I don't know what you want from
That's such
me.
a great point. And, it's funny, I have small kids, or they're not that small anymore, but like when they were younger, they would say like, Mommy, my dick feels tingly, or it feels... my penis feels tingly.
Right.
And I would just be like, okay, yeah, that's normal. Sometimes it feels like that. Like you'd go on a roller coaster and be like, I feel it in my penis. And I'd be like, yeah, that's okay. That's like, just a place sometimes you feel things and that's okay. But it's funny because...
Which is infinitely more than most of my clients ever would get.
Yeah, but it's so interesting because, we obviously in our home talk about genitals. We talk about like all the different things that happen. And there's never been, at least I hope there's never been like any shame around having an erection or having, any sort of normal function. But I think most people are like, don't talk about that, or we don't talk about our penis, or we don't talk about anything except for maybe, don't show this to anybody. Hopefully that's what they're saying at home. But like, so immediately you're like, this is something I have to hide because it's to protect myself. And we don't ever learn how to talk about it.
Hide, and my parents are ashamed of it. And you very, very early on get messages like, don't show this. Yeah. Absolutely.
And don't talk about it and ignore it. And if it happens, it's actually an embarrassing thing.
Right. And then there's like a whole group of people also where it's like, you're not supposed to do anything with this until you create a certain type of relationship, right? And so there's a lot of cultural things. And there's also this piece in the culture too that I hear often from my male clients of like, they feel almost like disgusted with themselves when they masturbate because it means they don't have a partner. So it's like, if I was a better man, or if I was a better lover, or I wouldn't have to masturbate. So there's so much that permeates into the psyche of men and all of us.
And I think women too, we don't, I can actively think about times where you feel like some pelvic congestion and you're like, why is that happening? Like, it's not like, it's almost like this is a very, why is this happening? And I don't want to think about it. And I have to get like, this is uncomfortable and awkward. And so I feel like the same thing is for women, right? We're just not like paying attention to our bodies and allowing them to even act normally.
Right, absolutely.
Yeah. In terms of like the most common obstacles that men experience when they're sort of going through these steps, what are the most common ones, and how do you sort of help them overcome it?
Impatience, by far. the impatience. Like, I've been doing this for 2 weeks. Why isn't it getting better? That's the most common one. Because what's true about overcoming early ejaculation, especially if it's been lifelong, is it takes time. I sometimes talk about it as like learning to do a handstand or learning to play guitar. Like, if anyone's ever tried to learn to play guitar, like, it takes so much time and so much practice. Yet when it comes to our bodies, we're like, this should just be happening versus like how much time it would learn to play guitar, which is a lot of time.
I mean, this with anything with sex. People think like it's natural. We should just know how to do sex. And your body knows a little bit, like this feels good, this doesn't, and then you seek it out. But it doesn't, like, it's a skill.
It is a skill.
And every part of sex is a skill, right? Building arousal, cultivating desire.
Learning eye contact, learning how to touch.
And everyone is different, right? Yeah. Each partner is different. So you might learn one partner, but then you go to another partner and you have to vary it a little bit. And you have to be open to, like, varying it and figuring out what they like.
And one of the things that I think doesn't get talked about enough is how much changes over the years of our life. Like, who you were as a sexual being in your 20s is not who you are in your mid 20s, your late 20s, your early 30s. Like, there's just so much change that happens, especially as you move through different relationships, or your relationship changes and grows and your hormones change and menopause happens. Like, you're not the same. And so also continuing to try and learn that, I think, is a really, really interesting exploration for every person that chooses to be sexual, wants to be sexual.
Absolutely. In terms of I think the other thing that Pete, you mentioned is like delayed ejaculation, right? And I find that this is a lot less commonly reported, but I don't think it's actually that uncommon. I mean, I do see patients who have delayed ejaculation, meaning they can't climax for 30, 40, 50 minutes, an hour. Right. And some people are like, oh, that sounds great. But the reality is
early ejaculators are like, fantastic, I'll take it.
Honestly, like, they're like, it's exhausting. I'm
my partners
frustrated.
Are exhausted.
There's only so much lube you can use. Yeah. Like, it becomes uncomfortable and frustrating. And I think that the reality is, like, this is also an issue. And I'd love to see, like, how do you handle that with your clients who come in with delayed ejaculation?
Yeah. Right. So the three main male performance struggles are early ejaculation, delayed ejaculation, and erectile dysfunction. Delayed orgasm is by far the most difficult to work with. I normally tell my clients, like, you've got to give me like 6 months before you can expect anything. It's very complex. Sometimes it is as simple as like how people are masturbating, like they're either bed humpers. And so or pillow humpers. So like when they go to have penetration sex, it's just a totally different sensation. They've been using no lube and they're just pressing down on the head of their cock. Which is great, best case scenario, because we can just start to change things and actually like give them a masturbation practice that's going to lead its way into a partnered experience where they might be able to find orgasm. What it often looks like is a trust piece, like a deep layers of like, it's not okay to let go. It's not okay to feel my pleasure. It's not okay to go into these places with someone. And so like most men, I haven't met anyone yet that is not able to find their orgasm by themselves, although sometimes they'll still struggle like to find, and it might be, an hour to find the orgasm, and it's impossible with a partner. So of course, like with all my methods, we start with masturbation. And it's about learning to differentiate in those experiences between like, I'm feeling my pleasure and I know that I want to move towards orgasm, and that feels like something that's genuinely coming from an impulse versus I think I should because I want to chase the orgasm. So it's this grasping versus allowing that can be a challenge for men to learn the difference between. And then how do we add in a safe partner and learn to let go when there's another person there. And it's complicated because not always, but many times the delayed orgasm folks aren't necessarily in relationship. So if they're in relationship and their partner's willing, there's lots of different things that we can try, like just telling their partner, ham and go masturbate in the bedroom. Just that knowing that a partner is. So I should backtrack. There's two ways humans are sexual, like solo sex, masturbation, having sex with themselves, and partnered experience, one or more people. And when we start to cross that barrier between I'm doing it by myself, but someone knows, we're now we're starting that rainbow over into the partnered experience. And so being able to say to my partner that, you know, you struggle to find orgasm with, or orgasm isn't there with, like, I'm going to go masturbate, it changes the way that masturbation experience goes. But it's gently building that space where, like, at some point we might ask that person to be outside the door or inside the door with headphones on reading a book, or ways to add them back in. And I see this honestly a lot more with women than I do with men, although men it's very obvious, the delayed orgasm piece. Because with women,
Right.
it's like, we just kind of like, yeah, there's also women who can't orgasm. It sort of in some regards gets written off. Where men, because it's so obvious, there's no semen, or of course, if you're trying to conceive a baby, that can make things really, really complicated.
Yeah.
So gradually adding people back in and working on that space of trust. Like, it's okay to trust people truly on that deep, deep level of the letting go that has to happen for the orgasm to be there.
That's so interesting. I mean, I think that it is probably the most least understood issue, especially in men, because it's. I mean, yeah, absolutely. Like you said, there are certain like things that you could be doing that could make it challenging, but it's often like, you know, sort of like the way you appreciate pleasure is different, right? And sometimes that
can be that
is,
too. What turns you on? Are you connected to what turns you on? Kind of.
Yeah. Yeah. And then you sort of like are not allowing yourself to maybe feel that full pleasure, right?
Absolutely. Yeah, there can be this part of like, there's a fantasy or a kink or a thing that someone really needs or wants that turns them on, and either they've completely shadowed it to themselves, or they know it but they don't allow themselves to go there when they're with a partner.
Yeah. I think, though, I will say that some people listening might feel like, well, I struggle with this, but like, no, nothing's wrong. Like, I'm perfectly normal. I like love my partner. I'm turned on, and it just doesn't work. And I think in those cases, like, yeah, there is certainly biologic reasons that can play a role. Yeah, absolutely. Low testosterone, variety of different things that can play a role. So, but yeah, I think that in some cases that kind of work can be really helpful. Yeah. Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to renamalikmd.com/morepleasure to download it for free today. The other thing I want to talk about is what I think that men don't really appreciate is the difference between ejaculation and orgasm. And obviously often these occur together, but they can occur separately. So tell me, like, how do you teach people about this?
The folks that are just having ejaculation don't realize that they're not having an orgasm. Like, it's more or less the folks that are in that early ejaculation category. It's like their experience. I will often ask, I'm like, okay, so when your ejaculation happens, does it feel good? And most of the time they look at me and they're like, honestly, no. Like, it's fine, but it doesn't really feel that great. So that's when we know we're in that territory of like the body is just moving into the ejaculation versus the body is actually undulating into pleasure and really expressing itself. Yeah. Does that sort of answer your question?
Yeah, I mean, I think we know that ejaculation is a reflex, right? So your body you will hit a point of no return and you will ejaculate. An orgasm is a brain event, right? So your brain hasn't caught up or hasn't actually gotten to the point of mental climax, right, to achieve the orgasm.
Yeah, you say brain, I always think body, but yes,
that's where it comes from.
Right.
Yeah. And then I think the other big issue that we see in men, and I'm sure you've seen this in your clients, is that men feel like their penis is not big enough.
Yeah.
How do you work through those thoughts with men?
It's a very delicate subject to have conversations with people about their body parts, especially something like your dick or your cock, because it feels like this is my manhood and this is who I am. And if it feels like it's too small, then I'll never get to have the woman that I want, the relationship that I want, or the sex that I want. And it is a deep, deep grief. And so I normally start with clients like, where are they at in the process of their grief around that. Like, is it that they thought they should be bigger? Is it that they want to try and do things to make their penis seem bigger? Have they been shamed by partners in the past? Like, there's the idea of moving into acceptance, but I think first we have to really, really process the deep grief that's there. What I normally say to clients is, some women do care about the size of your cock. And if you feel like you're smaller or you are smaller, that would be a very bad person to partner with. There's ways around it. There's strap-ons, there's dildos, there's all sorts of other things that we can do. But in general, if there's a woman who feels like she's a size queen, would be the term, it would just be a bad fit for you. And I would say it's between like 20 to 40% of women are reporting that they want someone of bigger size. So there's a big percentage of women that it doesn't matter for them. Like, they actually might appreciate a smaller penis and they're okay with that. And so oftentimes having conversations with men too, it's like, it's not like every woman out there, 100% of women are saying like, I need a man with a big cock. Like, I know plenty of women who say like they like smaller cocks. Plenty of clients that I've had conversations with that say like sometimes their partners feel too big and they actually don't like it. They would prefer the other direction because it does cause some problems, especially in long-term couples. Like, once the woman moves through menopause, like that larger penis can create a lot of issues as the vaginal walls start to thin. So I think there's a combination of that grief work plus that psychoeducation point, and helping men learn to accept their bodies for who they are. Because, I mean, we're all very, very different. And I think there can be in our society this feeling like we're all supposed to be the same and we're all supposed to want the same thing. And we miss a lot of that nuance around that we all want different stuff.
Yeah, and it makes sense, right? Because you can't like go anywhere without hearing some joke being made, something, you know, like even like my young son will joke about how large his penis is, and I'm like, you're prepubescent, like let's not have this conversation, right? But like it is just sort of so commonplace. And so I can absolutely empathize and understand what a man feels, like how much of a blow to their ego it can feel. But like you mentioned, the reality is that most women, the majority, don't want a larger penis and are very satisfied. If you look at studies on satisfaction rates are even higher, like 85%. So like when you end up with a partner, they're usually very happy with your size. And to be quite frank, and I say this on my channel all the time, is like, size doesn't mean more pleasure, right? Like you can provide pleasure without penetration. You can and likely they don't need it, right? The clitoris is the most reliable source for pleasure, and it doesn't require penetration to be stimulated. So I think like, yes, it is a struggle, but it is helpful to think about how you sort of talk through that with patients, because I think like, again, I feel like men are very hesitant to go seek like a therapist or, you know, a coach or any sort of like person who's going to talk them through these issues. Like they'll come see me and I'll be like, look, you really should see someone. And they'll sort of really push back. And I'm like, just try, just go for one session, you know, just like try. And, but they do feel, I think there's like this big block between like going to seek help from a doctor where there can be a medical issue versus someone who can really like work with them on their thoughts and like acceptance and all those sorts of things.
Well, you just gave me an idea as you were saying that too, because you were saying there's not more pleasure. And I first went to like, oh yeah, there's not more pleasure for a guy with a bigger penis versus a smaller one. But I think you were talking about for your partner. But it's also true for both, right? It's like, just because a man has a larger space doesn't mean he's actually going to have more pleasure. So I don't know. That was a good.
That is interesting.
I'm going to take that next time I work with someone and remind them.
Yeah, it is good. What about, you've talked about breath work, you've talked about using breathing, and I think it's so valuable. In fact, there was a study recently, it came out this year, that men who did diaphragmatic breathing, in addition to like other behavioral techniques, they lasted 900% longer. I mean, 900% longer just by adding breathing, which is so impressive.
Well, and breath work and meditation is having all sorts of wonderful things happening in the studies that are going on too, because there's all these studies now about depression. They're comparing depression medication versus meditation, and actually the cohort doing meditation is doing just as well, if not better, actually, than the group of medicated folks.
Yeah, absolutely. And I think it's just like you got to do the work, right? You have to, like, it's hard. I've tried to meditate many times and I'm like, oh God, what am I doing? Like, this feels like a waste of time in the beginning. But I used to do it with my son. I remember when he was younger, and he, like, we did it before bed, so he would sort of calm down, go to sleep, and he loved it. Like, I could tell, I could feel him just feeling calmer and more relaxed and, like, just happier. And I was like, this is just a skill that, like, we all should know how to do. I think it's really useful. And you've actually worked on sort of what's called Sexless meditation workshops. So tell me a little bit about those.
Yeah, those are some of my favorites. So the Sexless meditation workshops and the work that I do, everything that I do is centered around mindfulness. Much of my training has been in mindfulness. My mentor, John Wellwood, who's passed away, was considered the grandfather of transpersonal psychology. And I take a lot from that idea of, like, what does it mean to be in our bodies? Because when I think about why people show up and what do people want from sex, it's like they want to have a feeling of connection, and they want to have a feeling of, like, okay, I'm here and, like, I can just relax into these moments truly. And so Sexless meditation is saying, like, okay, meditation doesn't always have to be just sitting still. Like, there is a reason to do that. But there's also walking meditation, and there's movement meditations. And when we take sex into a mindfulness practice and it gets to become a place of exploration and of meeting the present moment, which essentially happens for most of my clients that I work with long enough, is like sex now becomes like this whole thing that we're doing to drop us into ourselves more fully, to get connected with who we are at our core, to remind us of, like, what's actually important, and to sort of drop away all of the other things, all of the comparisons, all of the judgments, all of the shoulds, and just sort of reach into ourselves and find that place of deeper peace and deeper meaning.
And that's sort of like where Tantra, it's sort of derived from Tantra, right? Which is tantric sex or Tantra, which is like essentially when a couple is actually meditating during the act of sex, right? They're using sex as a means to get closer to God and to feel sort of like in their energy, right? So that makes a lot of sense. And, it is sort of, I wish we learned more about that stuff. Like, you actually have to go seek that education.
In India, right?
But I think that, like, there's so much value in bringing that into the bedroom, because so many times, like, sex is this rushed thing. It is not, it's enjoyed, but, like, in short, quick bursts. Like, we don't make time for it. We don't, like, make it a priority. Like, we'll make date night a priority, but we won't ever make, like, intimacy and sex and being together, like, actually a big part of our routines.
Right. I often think of it as that, like, people get confused between passion and pace. Like, they think that passion means to move quickly or to, like, go in this really, really fast way. But real passion means, like, meeting the moment and following that inspiration. And so to be able to do that, we actually have to feel into ourselves and be wide awake. Right? Which is essentially what meditation does. It wakes us up into the experience that we're having. So when we can wake up and be like, oh, this is what feels right now, and I'm going to follow that place, then we're entering into that space of Sexless meditation.
If somebody wants to get into Sexless meditation, what is something they can do that to start sort of being in this mindfulness space when they have sex?
Slow down. Just slow. Everyone, everywhere should just slow down. Everything you're doing with sex, like, walk it back, like, a lot. Giving yourself time to honor and to notice the sensations and the feelings that you're having is a huge step in the right direction. And that goes, again, this is for people who are not partnered or having partnered sex at the moment. Like, this goes for masturbation as well. Like, if you just slow everything down, if you gave yourself some time to lay down, to close your eyes, to touch your whole body, to just breathe and notice, and then move into self-pleasuring and stay connected and notice what comes up. Oftentimes, so many different things will come up, but it'll start to give us clues about, like, our desire and our wants and the things that we want to ask for, the things that we're missing, or the places of pleasure. And in that also comes this innate curiosity, which I think is so crucial to long-term sex. Like, for couples wanting to be together over and over and over again, there has to be this level of curiosity. And to cultivate curiosity, we have to be relaxed. Like, we can't find curiosity from, like, a stressed out, clinging, grabbing, striding place. We have to be able to sort of, like, sit back, take a breath, feel our bodies, and then see like, okay, what's here? Can we wait till something arises and then follow that?
And I think also being really in tune with your partner's responses. So I think like we are so attuned to like listening for sounds, and there's obviously certain things that you might like very obviously notice, but there's also like minor things, right? That I think you can pick up on that, you know, especially when I think women, if you're in a heterosexual relationship, women are not as vocal because they weren't trained to be vocal about their sexual needs and their sexual pleasures. Maybe, hopefully that's changing in younger generations, but I think that like, so they may not say something, they may not respond like so robustly, but they may be liking something or not liking something, and if you pay attention, you may actually start picking up on those things.
Yeah, absolutely. So if like we think about slowing down, and then if we're not sure where our partner is, one of my pet peeves, one of the things I'm always saying everywhere I go, is we don't ask people, do you like this? Because it doesn't tell us anything about the direction we should be going other than yes or no. We ask people, would you like me to go faster or slower, harder or softer? So then we get a sense of like, okay, there's no way I'm doing it perfectly because I'm just learning your body, or you're not my body. And so I'm just trying things on. And then it tells us like, okay, which direction should I go? What is there? Can I meet this person's needs? And I think that that's a really important piece around like, how do we learn to listen and to pay attention to a partner's body if we're not sure, if they're not giving us signals. So it's like, okay, I need to go a little bit slower. Got it. Great. Or I need to go a little bit faster. Got it. Great. And then we can go in that direction, which is really helpful. And
giving them the words to say what they want, right? Yes. Because if you say, do you like this? And they say, yes. Okay.
It's very rare that someone says no. And even if it is a no, my experience most often, because some of the work that I do with couples in my session is touch, like that I'm witnessing. And so I'll see a partner kind of like look very uncomfortable in their body and in their face. And I'll be like, what was that like for you? Oh, that was great. And I'm like, that didn't, my experience of watching you seems like it wasn't great. Like, let's talk about what's going on there. And then turns out I was like, well, I don't want to disappoint my partner. I don't want to tell them they're doing it wrong. I don't know what they could do to make it better, is one I hear a lot.
Yeah.
So if we get into this place of like, we're not just asking for, did I do it right? And we say, you know, what can I do better? Basically, like, how can I do this better with directions?
Yeah, or give options. Are you actually watching couples be intimate together, or how are you seeing this?
The way that the things I normally say to people is like, I could if it needed to happen.
Sure.
But it's never happened.
Okay.
So it's never been something that's needed to happen, because a lot of the places where the disconnection happens or the disruptions happen are long before clothes come off. Like the cutting off, the slowing down, or the cutting off and the sort of defenses that show up where couples are missing each other happen much earlier than before clothes come off. Yeah.
So give me an example of something that's happening earlier. Like where are you seeing this sort of happen?
Yeah, it can happen just the minute someone turns towards their partner, right? So like I'll have, and mostly just work on Zoom these days. So I'll say like, okay, let's turn towards each other on the couch. And you'll watch someone turn and one person's leaned in and the other person's like is leaned out. And one person, and I'm like, oh, that was really interesting. Like, you know, what's happening there? Oh, nothing. This is just how we normally are. And so we start to explore in that mindfulness space of like, okay, I might have the person who's leaned in lean out a little bit. And then the person who's leaned out takes a deep breath. I'm like, oh, you're taking a deep breath. Like, oh, yeah, it just felt nice for my partner to lean back a little bit.
Interesting.
So, I mean, there's so many subtle things that the body are doing. And in our couples, we don't, unless we have someone with a trained eye watching our bodies do different things, it can be hard to get to those places. But even things like eye contact or moving in for a kiss or touches, a lot of times couples actually don't like the way their partner touches them, or they may touch in a more comforting way, not a sensual way.
Yeah.
So learning all of these skills, learning how to put those things together, and learning what to do if they feel like their partner goes backwards on the arousal curve, like how to bring them back up.
Wow.
One of my favorite exercises, though, I thought of it earlier when you were talking, is I'll have one person lie down flat and the other person sit next to them, and both people close their eyes. And I'll have the person sitting put their hand way, way above, as high as they can, over their partner. And I'll say, you're going to follow me with my hand, and we'll start to move down, and we'll tell the person laying, let us know when you can feel the presence of the other person's hand. And normally the hands are like quite far up, and I'll have them both open their eyes and see like, oh, you can start feeling your partner's energy when you're, a couple feet from each other. So all of that is influencing what's happening during sex prior to even physical bodies touching. And these are all things that we want to be thinking about to explore pleasure.
So fascinating. We've talked a lot about like sort of how to improve things when you're trying to be intimate, but there's people who are in what we call sexless marriages, right, where like intimacy is
lots
long
of
gone.
People in sexless marriages and partnerships. Yeah.
What are some red flags? So for people who are in relationships, that they can sort of try to make sure they don't end up in that scenario. Like, what are things that they can sort of take notice of and maybe say, hey, wait, this is a sign we need to work on things?
Well, interestingly enough, the first thing I think of is that they're not communicating. So they wouldn't say that. That would be a red flag.
Yeah. But they may notice like nonverbal things, right? They might not say like, oh, I don't want to have sex today, but they might notice these nonverbal cues.
Right. From the beginning, if you can, to make talking about sex and the things that feel good and the places that need work normal in the couple. Mm-hmm. If you aren't in the beginning of a relationship, if that's not possible, and it feels like the sex has sort of disappeared, I think the conversation has to happen. Sometimes I hear from people, it's like, well, I don't want to bring it up because it's just going to make it worse. Or I'm fearful to bring it up because I don't know how to have this conversation. And I totally understand that. Like, again, we talked like there's so many things about sex and the complications and how important these conversations are that we never actually learn how to navigate. Mm-hmm. And there's so few places to go to sort of learn how to have good conversations.
Yeah.
But when it feels like, oh, I used to be able to do that, and my partner would respond with like an openness and like a closeness, and that starts to feel like it's closing down, more often than not, I'd say like, I normally talk about things often as like the 80%. Like if it's working 80% of the time and 20% it doesn't, it's sort of not a problem. Like we don't want to focus on it. It's like, that's normal. But if it starts to feel like, oh, 50% of the time or 60% of the time or 70% of the time, I sort of make this bid towards my partner in a way that used to bring closeness, whether it was a laughter or just like a hand squeeze or a kiss, or it led into sex or a playful, sexy place. When those things start closing down, that's when we would want to say to our partner, hey, when you're ready, I'd love to talk about our sex life. Like, would later today be good? Or could we make some time this weekend to talk about it? Not just springing it on your partner as you guys are having breakfast and running out the door, or in between kids coming in and needing things. Like, we really want to give space to have this conversation with our partner and to give it respect, the respect that it deserves, and the space to have a conversation. And the biggest thing about these conversations is they're not one and done. The mistake I see most of my clients make is like, well, we talked about it. I'm like,
and it usually goes horrible and it's super awkward.
And it was once.
Yeah.
But it's bad timing.
Of course it's going to be uncomfortable and awkward the first time.
Yes.
Right?
Absolutely. For most people, it's very uncomfortable and awkward to talk about these places, especially if it feels like we're a married couple and maybe we're doing everything else right and we feel like so together and we're like the PTA and the whatever, but we're not connected in this way, and one person wants to be. And one of the things I'll also say is there's lots of couples that are not having sex and they're totally fine. Mm-hmm. Both people are genuinely fine with that. And the piece where it becomes an issue is where one person is like, hey, I actually don't want to live like this. Like, actually, I do want to have a sexual connection, and what would be possible? What are you open to? How do we find what's pleasurable? And most of the research points to that if you seek help, if you seek treatment, that there's pathways back into sexual fulfillment, that it's not like these couples, like once it's over, it's completely lost. I try and really normalize for couples, like sex is this long journey, and sex is like a language between couples.
Yeah.
And it's very, very complex, and it needs lots and lots of different flavors and energy. And so it's learning each other's languages and continuing to develop that.
Yeah, why do you think people get into these ruts of sexless marriages? I mean, I have my own theories, but I'm just curious, what you've seen as like the sort of the triggers that end up sort of starting these situations where people find their way to sexless marriages.
Right. Many reasons. Sexual dysfunction can be one of them. Resentments can be another. Stressors, job, family, hormonal changes can be a big component, especially after babies come. Some people just lose desire in sex. Some of the most complicated to unravel are rooted in like the childhood beliefs about intimacy and closeness. All of it. There's so many reasons. Mental health, depression, anxiety, diabetes. I mean, there's so many ways in which a couple can end up in a sexless marriage, and many people are living in them. I think the rates are between like 15 to 20% of people are in sexless marriages. And the interesting thing about sexless marriage, though, is there's sort of like two definitions out there. One is like haven't had sex in over a year, and the other one is sex less than 10 times a year.
Yeah.
Which I think is
a research study definition, basically.
Right. Which I think is really interesting. And what I normally go with my couples with is like, what do they consider sexless, and where do they feel like, because in the sexless couple, there's the absence of sharing that sexual space together. And so it's like, where did they feel like that stopped? Around what time do they feel like that stopped? And where we really want to start to look at, like, are there pathways back in? If it's resentment that has built, or there's underlying like childhood trauma, different pieces, sometimes trauma, you don't know it's there and it can pop up later in life, and suddenly you remember something and now you're working through that. But really the pathway is like, how do we get back into pleasure? Like, is there a pathway back into that?
Yeah. And I think that the real challenge that I find with my patients is that, like, it's not just sexless. It becomes like there's literally no intimacy.
Yes.
And men are often really taught that, like, sex is the only form of intimacy. Like, they're not like cuddling and hugging spontaneously and those sorts of things. And so it's the sad part to me is that it all gets lumped together, right? It's like, the only way I can have intimacy is by asking for sex. My partner keeps saying no, and there's no other intimacy at all. And so they'll go like, years without even being held by another person.
Right.
And so that's where I think the real challenge is like, how would you tell a couple, like a young couple, like, how do you sort of maintain that through the ups and downs, potential traumas, and things that are going to come up in life?
Yeah. Well, I want to answer that, but I'll go back real quick. I often say, like, couples are touchless long before they're sexless, because they're only going to each other for these like just quick intimacy sex needs versus that holding space and that connection space. But what's interesting when I start to talk about these like cuddles or these touches or these moments of connection in couples where sex is sexual frequency, or a space that feels sexless in that moment, oftentimes one person is like, well, I don't want to invite that person into sex because I'm not open to it. So if I let them come and snuggle me, they're going to try and escalate it. And so I've shut all of this touch down because there's no safe container for me, because I don't want to move into intercourse at that time. And so sometimes it can be really helpful for that other person to hear, like, oh, you're feeling so much pressure and you're not ready right now for us to move into this like genital focused pleasured space. Okay. And what I normally say is, the coach is like, we're going to just take that off the table. Like right now, we're just going to all agree, like no one's going to have genital touch. And so sometimes seeking a professional that can just like blanket statement say that in your couple is really, really helpful. And then what do you say to younger couples? Keep talking, talk more, explore your own sexuality, be curious about it, and keep telling your partner about what's going on for you. It's like, that curiosity is incredibly important in maintaining that erotic connection.
And the more you do it, the better you get at it, right? The more you talk, the better you get at talking, and the more, And the more you have sex also. But yeah, it just ultimately like makes every conversation easier, not just about sex.
Right. Absolutely. Yeah. I have a dear friend, and he often says to me, he's like, I feel like when you can really have conversations about sex, there's no conversation that you can't tackle.
Right.
I was like, oh, I really like that. I never thought of it that way.
Yeah, absolutely. If someone's sitting at home and they're listening to this and they're like, oh, I am in a sexless marriage and I don't know the first thing. So I asked my partner to talk about it and she said no. And now here I am and I've been in a sexless marriage. What is the next step forward for them?
Like the partner just said, absolutely no, I won't have any conversation about it.
Yeah. I feel like that happens. I feel like that happens more than you know.
Yeah, I guess my next question would be to ask them why, but like they're not willing to engage at all around any of this.
Yeah, they're like, no, I'm fine with things the way they are.
Oh, okay, I'm fine with things the way they are.
And I don't want to
I won't talk about it at all.
But I also don't want to change it. Like I don't want to talk about it.
Okay, yes, that's very common. So when one person is fine with having no sex and the other person is not fine.
Correct.
Yeah, I've worked with quite a few couples in that situation. And obviously by the time they end up in my room, that person has decided at least to show up and have conversations about it. So it's tricky if someone's not willing to put in any effort whatsoever. I mean, that's heartbreaking. And I have worked with couples where that is the case. Like the partner is like, no, I don't want to. So in those situations, we explore like, okay, you are in a relationship that you want to stay in, and this person is not willing to be physically intimate with you. How do we process that grief? And what does it look like? Your options are to have solo sex, have affairs, outsource your sexual needs. Like, is that something, sometimes that's on the table for some people and sometimes it's not. So it's sort of looking at like, how do we respect that person's choice to say like, I'm not interested in being sexual, because that is a choice that every person gets to make, and giving the person who does want to be sexual those needs. Now, those are very extreme cases. I think most often what's happening is the one person who's saying like, I don't want to be sexual, has a lot of other stuff going on with their sexuality. They either feel a lot of shame or disappointment, or something's happened.
It doesn't feel good.
Pleasure doesn't feel good. They've never actually explored anything sexually that feels good. So I think it just depends on who you're partnered with. But that might be the place to start, is like, hey, letting them know, like, I'm not sure that I want to stay, if this is true, I'm not sure that I want to stay in this relationship that is touchless and eroticless. Can we start to have a conversation about pleasure? Like, I'm interested in your pleasure, not just mine, and sort of open up the conversation in some direction.
Yeah, I find that it's often just that like the partner, and this is not always the case, but like the partner's going through hormonal changes. They're also got lots of stressors in their life. Women tend to take the burden of childcare, of aging parents, of all these sorts of things. And now everyone's working. Like before, decades, generations past, women didn't always work outside the home, but now everyone's working, so they also have their stressors of work. And so I think all those things combined makes it very challenging. And I think I think when women say no, and I hope this is true, is that they're just like, I cannot add this to my list of to-dos right now. Right.
So I think it depends on when someone's saying no, what they're saying no to. If it's just like, I can't think about this right now because there's so many different things going on, and you know that about your partner, it might be like, hey, you seem really overwhelmed. Are there things that I can do to take stuff off of your plate? Those are all really wonderful. But what's true is it's not just women who don't want sex. There's plenty of men that decide like, you know what? I'm just not interested in that right now. Yeah. And so then it becomes this piece of like, where's the attraction? Is there attraction? Is there any desire? And one of the things that I see a lot with people that I think it's not discussed enough is the one person with lower desire or no desire, they're not experiencing pleasure and they feel really hopeless around that. Like, there's no desire, there's no energy. They've had their hormones checked. They've done all the different things, the Stanford studies, the whatever. And they're still just don't feel erotic energy. And when you start to get into the conversation with them around like what's pleasurable, and they just don't know, and their partner's like, you have to know. You have to know. And it can be confusing to be with someone that feels like maybe they knew at some point or however they're reporting it, and then suddenly it feels like their sexuality has changed so much and their desire has changed so much that they're really not sure where it's at. I think of that as like a really exciting moment to get curious and start to explore a lot of different things and see what's in there, but it can feel very terrifying for somebody in a relationship with somebody else that's like, I have no idea what turns me on and I don't know when I'll find that.
Yeah.
And so holding space for that is big.
And I think when you find someone who you love, who like genuinely loves you, and they're like, no, often it's no, not right now, or
right.
no,
typically it's not right now,
or no, yeah, but like it's usually not a no, close the door, but it might sound like that. It might sound like no. Like they might just be like, no. And you're like, wait, what? No, not ever. And so I think that's where like, okay, maybe that's not the moment to ask again, but just be like, look, I know last time you said no, you know, maybe in a couple days, a week, whatever. I know last time you said no. I'm wondering if that means no forever or no, not right now.
Right.
Because I think that does come down to like, okay, so what do we do next then? Like, I love you and I want to move forward and I want to like, then do we continue in a relationship and I find my needs met elsewhere? Do we not continue the relationship? Well, what are the options here, right?
Absolutely.
And because it is a relationship, we have to work together.
Yes, absolutely. And I think that ability to listen in a non-defensive space and to not treat any conversation about sex as a one and done. Like I cannot emphasize this enough. These are ongoing, continual conversations. And we want to give people lots and lots of space to think about them and to come back over and over again over the years of like, what does sex mean to you? Because it will change. It will change over the arc of a relationship. What it meant the first year of your marriage is not going to mean the same thing 10 years into your marriage. It just won't.
Yeah. And the last thing I want to talk about is, porn and sex toys and things that are that should be used as tools are often a big source of like shame, anxiety from both sides, right? Either the person using, the person not using, both, whatever it is. And so how do you sort of work with couples in situations where maybe one person is feeling the other person's using one of those tools, either pornography or sex toys, as a sort of like, and feeling insecure about themselves?
Right. I don't know that I would put porn and sex toys in the same category together.
Sure.
Because
I do find they both lead to some insecurities at times, which is, I think, why I set them together. But they're different. I agree.
Yeah, because I think, porn is a curated movie to bring arousal to people. And it is not real life. Most of the men specifically are on performance enhancers. If you go and look at the porn stats, there's like 7 guys and like 300 women that are actively working in the porn industry. I mean, it's fascinating because it's like, I've done some consulting for the porn industry. It's very interesting. And it is created literally all day filming that's edited and cut and lit and all of these things just to bring arousal. And so it can create this idea of, well, it looks seamless. It is not seamless. And even if you're watching the amateur porn too, it's also, I guess some of them probably are, but the biggest trouble with porn is it sets up unrealistic expectations. The type of people who would be interested in filming their bodies clearly feel very comfortable about their sexuality, and they're doing things because they like to perform on camera. And there's so many different variations of that. And I love porn because it can give people access to places, turn-ons, things that they might not know that they were turned on by. So you could like wander through your whole life and never find them, but you're like, wow, that was really sexy and really turned me on, which is fantastic to know about ourselves. And being able to actually close our eyes or to put our gaze onto one single person and get to know them versus this huge excitement of the superhighway of what porn is. And when we talk about like ejaculation versus orgasm, whenever I watch porn, I feel like I'm just mostly having like an ejaculation experience, I don't feel like I have like my whole body engaged and you would say your brain engaged, and really like moving into that experience. It just feels like this quick thing that just like moves into that. And so I often say to people who are using porn a lot is like, can you step back and actually masturbate without porn? And if you can't do that, then you're most likely having an overuse of porn struggle. And we would want to move you away from that so that you can find pleasure without it. Jealousy is normal. It exists in many, many different containers. I think some people veer towards more jealousy than others for various reasons. And if you do feel jealousy about your partner's porn use, it's something you would want to start to talk about and to normalize in the relationship, but we don't want to move it into the shaming and hiding space. Mm-hmm. If you feel like someone is overusing porn and you shame them and be like, I think you're overusing porn, something's wrong with you, I listened to this podcast, this person said, you know, whatever things that people can do when they feel scared, because that's really what that is, a scared reaction. People will do things underground. I mean, that's what we know about people with sex. If you shame them, they will hide them from you, and they will still do them. They will just do them underground, and you will never see them. Esther Perel talks about a secret garden, and I have seen that, and I truly believe it. So we always want to come into like, this is how it makes me feel. Can we talk about all of these different things? And if someone does feel like they have an overuse, you would want to open that conversation up and have a discussion around it. Toys.
Well, before we go to toys, let's finish the porn conversation. Okay. So I think the interesting thing that you mentioned is like that people will do it underground. And obviously I know this to be true, but I think it's interesting because I see it from a lot of like, you know, women's groups I'm involved where they're like, oh, my husband is not allowed to, or my husband, right? And I just crack up in my head. Like, my husband is not allowed to do that. He can't do that. We don't allow that in our house. And it could be a variety of things, but oftentimes it's like porn, right? And I just think it's so funny that people actually think that they have so much power and agency over another human being to say, you're not allowed to do that anymore. Like, you are
just
not
makes it more exciting most of the time.
I know. And you're like, you're not their mother. And even if you were their mother, they would still find a way potentially, right? Like it's...
right. The conversation then becomes like, it makes me uncomfortable because I feel like I have a problem with the porn industry, or I have a problem with where you're sourcing your porn, or you're turned on by things, and maybe you have a belief like you should only be turned on by me, but you're watching other women. I mean, there can be all sorts of reasons. It's just really important to talk about. I think sometimes it can be important in those situations for women to actually view porn. Like, instead of taking the like, you can't do it, to be like, show me what you're watching. Can we watch it together? And that can become an issue. Like, if couples, I do see couples where it's like they're only intimate when they're watching porn. And again, I do feel like it's an issue. Like, if any situation, you have to have something in it that feels like now it's a crutch. And that's not the point of porn. That just feels like it's now taking everything away from the rest of the pie that can be there and putting this like one tiny sliver in.
Yeah. I mean, I think, you shouldn't need to rely on anything but your brain to feel arousal.
Yeah,
right?
The fantasy.
Like it could be a fantasy. It could be porn in some cases, obviously. It could be other things, but like, you should be able to be aroused like without needing a curated, very exotic, very erotic film that might be, you know, might have some sort of arousal trigger that is like not even possible in real life, right?
When I'm working with clients, I created a model. I call it the balanced human sexuality model. I probably need a better name, so if anybody has branding ideas. But if you imagine a circle and you divide it into 3 parts, one side is sensation or erotic embodiment. So that is like, how are we actually feeling our skin? How are we actually feeling our body? What do we notice? Like, how do we take in touch? How do we give touch? This is the genital center. It's like our physical body. Then there's relationships, intimacy, and love. So that's how connected do we feel? How open do we feel? Can we be in relationship with someone? And then the other part is anticipation, fantasy, and creativity. And porn falls in the subsection up there because it is that fantasy space. But if you can't find arousal, if you can't find things that turn you on, if you can't make a mind movie into fantasy, that is a problem. And you will feel limited. I'm not saying it's a problem like you're bad or wrong or we should shame you. It's more like you're going to constantly feel limited in your sexuality because you've found this crutch. And so when I work with folks in those spaces, I'm like, let's just start to explore these other 3 areas, and let's give you back access to your creativity and your anticipation and your fantasy, because it's only going to serve you at the end of the day.
Yeah, I do think, it's interesting you mentioned that, but I feel like we're seeing some newer science around AI and how it's making
Oh,
people
goodness.
less interested, less intelligent even. Like they're
Yeah.
not using their brains as much because they're
Correct.
relying on AI. And I wonder if the same thing is happening with porn, but
Totally.
also may happen even more so with AI things that will come up like AI
Yes.
porn and AI dolls and, virtual reality and those sorts of things.
Yeah.
I feel like they will become so real and so curated to what you like
Right.
that you may then shut off your own brain's ability to sort of get turned on by normal
Right. Well, we'll be
things.
having our limbic systems will be completely hijacked by AI. So we'll be having, some people are already having full relationships with AIs, and their needs are being met, and all of their conversations are happening, and there's I love yous and all of these things. Yeah, it'll be a very interesting time.
Do you think that we'll get through that? Like, do you think that there will be a regression to the mean, sort of like people will be like, oh, I don't want that anymore? Like right now, I think it all feels novel and exciting, and people are like, oh, like AI's number 2 or number 1 use is as a friend.
Right. Yeah.
So like, do you think that people are like, oh, this doesn't feel real? Like I've never met this AI friend, and like I need real connection.
I don't imagine that the people who are in those relationships feel like it isn't real. I think for them, they genuinely feel like it is real. I think as humans, we are programmed for wanting connection, and we're programmed for wanting intimacy. And the trouble is when people have experiences in their life, predominantly childhoods, that don't lend easy access to being able to do relationship. They don't have the skills, they don't have the nervous system, they don't have the ability to tolerate the discomfort that happens in real human interaction. Because in real human interaction, I bump up against you, you go, ow, that hurts. And you bump up back, and then there's tension that happens. That's not going to happen in AI. And so you can experience a level of closeness with an AI that doesn't have the tension. And for some people, that's really, really important. I don't know exactly where all of this is going, but I know that I would rather have people that are really lonely feel like they have someone than no one in many regards.
Yeah.
And I also think on some level, and maybe I'm just too optimistic. My husband's Parisian and he's more pessimistic, so
you have to balance each other.
I feel like when we can build safe and healthy relationships, our nervous systems can heal. And so I think there might even be a potential where someone feels like I can go out into the real world and have more complicated bump up relationships and come back into the safety of this one where this person's going to say like, everything's okay. Almost like a mother would be in many regards, or the ideal mother, the perfect Winnicott mother. It's like, everything's okay. You're going to be okay. Like, I still am here for you. I still love you. So ask me in a couple of years.
I mean, a couple things that came to mind was one that like, yeah, I do agree that I would rather have people not be lonely and depressed and like suicidal or whatever, right? But at the same time, it's like if we become comfortable with AI filling that void and we don't seek out other people, like are we headed to a huge, true loneliness epidemic?
Right. I think it's a really big question, but we're already in a huge loneliness epidemic. I mean, we already truly are with our seniors, with our young kids. I mean, we really truly are already there in many regards. And some of the clients that I've worked with have struggled to date or make these connections. It's a real challenge. I don't have any answers to it. I just know that it's a real challenge, and where it goes will be very, very interesting. It's already here, though.
Yeah.
I mean, people are already finding these connections, and if we shame people underground and again make them feel like they're bad or wrong for having these, I think it's really tricky. And when you're a person who can really easily tolerate the bumping up against, it can be hard to understand how difficult that is for people, like how much it shuts them down, and what a savior something like AI can be in those situations, actually.
I also do think that AI will learn to build tension.
That would be fantastic.
Like it will, like right now it's very, pleasing.
Agreeable. Right.
But I think that it will be like, it will learn that humans need some degree of tension.
Yeah,
and maybe
and
it
what
will,
if it
it will
said-
elucidate that, and then it'll be
Right.
like, I'm mad at you, or whatever.
Or what
right?
if it said like, oh, you're mad at that person because they did that? Well, that sounds like, you know, what do you think your role was? Like, what if it shifts? I mean, who knows where these things are going or where
Because
they
right
end
now
up, but-
it's actually almost too complimentary. Like,
Right.
it's someone will be like, I mean, you've seen the headlines, like someone will be like, I think I should harm myself.
Yeah.
And they'll be like, go ahead.
That's
You know,
a
like,
good idea.
yeah,
Right,
like,
yeah.
and so there are dangers. And anyways, I think we can speculate for hours. Like, it's
It's fascinating though, and I think it's something we all need to be really, really talking about. And again, talking about like, how do we build resilience and how do we really teach our kids? You know, as a mom of a 4-year-old, and I know you have kiddos, it's like, how do we teach children to bump up against each other and not, and the same with the political climate, and not just say like, you're out. Like, how do we really say like, let's stay in this, let's have a conversation, like, let's see where we can find common
like,
ground.
be
if
okay
any.
feeling discomfort.
Yeah, and be okay not getting along and still feel like I can sit next to you.
Yeah.
I think those are really important human skills that we're very quickly losing.
That's so sad. Let's move to something a little more
We're trying to
happy.
yeah.
So in terms of like, you've practiced for a long time, what's something that you did in the beginning of your career or believed in the beginning of your career that now looking back, you're like, wow, that was so wrong?
Oh, you know what? Something that I do feel like I really didn't understand. My training was through a holistic program. And so there was a lot of hippie things going on. And I was not a believer in antidepressants. I was pretty like, you should just dig your way out of this and work harder. That I think was really, it took me a couple of years, but I started to understand like that's not, antidepressants are incredible medications for people who need them.
Absolutely. Absolutely. And yeah, I mean, I think there are people who can do without it. And you, as you mentioned, mindfulness, exercise, there are lifestyle things that you can do that can help improve mood. But I do think that they are incredible tools to help brain chemistry, which is altered in people who have depression, anxiety.
Right.
You know?
Absolutely.
Yeah.
Absolutely.
If you wanted to, we've talked about so much and we could probably talk for another 2 hours, but if you had to say, like, what is the most important thing you want people to take away from our conversation so that they can have great sex, be intimate with their partner, feel connected, feel pleasure, what would that be?
I'd say there's two things. They kind of go hand in hand. I think the number one most important thing for people is to slow down. To just, again, I think I said it earlier, like blanket statement, just slow everything down. To take your time, to take a breath. It doesn't mean don't move, don't take action, but to just let everything sort of come and be. Those are two terms there.
Pun intended.
To really allow that to move. And then the other piece is to make space for the changes that happen in sex around the lifetime with someone. Like if you're going to be in a long-term relationship with someone, their sexuality is going to change and your sexuality is going to change. And so to make space for people to make those changes. Like sometimes I'll work with couples, they come in, they report mismatched sexual desire. Turns out one person's not getting the sex that they want. And when we actually have the conversation, one person says, well, I just don't like it when we do that thing. The other person's like, I thought you loved that thing that we did.
Yeah.
And they're like, I don't want to have sex because I just don't want to do that thing anymore that you're doing. And it's like they've just never had a conversation about it. And the one person's feeling so bad. They're like, I always thought you liked that. And how did I miss that? And it's like, no one is in trouble here. It's just things change. People's bodies change. Their needs change. Their desires change. What they fantasize about changes. And so giving space in long-term couples and giving space to yourself to see that sexuality is this like more of a journey than it is necessarily like a place that you end up and you don't leave.
Yeah. Sexuality is not static.
Yes, perfect.
Yes. So if our listeners want to learn more about you, find your course, where can they find it?
Yes. So the best place to find me is on my website, which is KeeleyRankin.com.
We'll put it in the description.
Perfect. Yeah. And I have 2 courses right now. One is called Keeley Sex Class, and it's sort of all of the things I gathered over the years, like into a 12-module course that allows people to just move through, find better, more pleasure in their bodies. And the other course is for men who struggle with early ejaculation. And for your listeners, for the first month after this course, or after our podcast launches, there'll be a special code RENA20 for them to get 20% off.
Awesome.
And also I'm launching a new newsletter, but it's going to be a different format newsletter. It's going to be delivered the first Monday of the month to you, and it will be 5 things that I think are important about sex. So it'll be like latest news or stories or like cinema or different pieces that I feel like are helpful in just sort of like building that ongoing curiosity around sexuality. And then another really great place to find me is on Instagram, which is Keeley Rankin Intimacy Coach.
Awesome. So we end our podcast with 4 questions we ask everybody. So it can be whatever first comes to mind. And if you don't have an answer, you can think about it. Take your time. What's something you know about now that you wish you knew earlier, outside of taking outside of antidepressants, since we already mentioned that?
Okay.
It can be about your life. It can be about anything.
I'm not sure if this is exactly the answer to your question, but I've been really thinking a lot about how as we get older, we start to understand why people do certain things, even if we might not do them ourselves. We start to understand how someone might get there. Okay. And I've been really appreciating that as I've gotten older and as I've sat with so many clients. It's like, oh, I'm not sure I would make that same decision, but I can totally understand why someone might make that decision. And I'm really appreciating getting older because I feel like my sense of judging people is just completely shifted, because I'm just like, yeah, I can understand why someone might do that. Makes sense.
That's good. What's a non-negotiable, something you have to do every day?
I mean, I have to do every day. I have a 4-year-old, so that I don't.
There's not much time for
well,
something.
No. Okay, well, ask me that in 10 years. Probably, I guess, right now, a little bit of caffeine. I have to have a little bit of caffeine, but not too much every day.
Okay. What is a life hack or health hack that you would share?
Oh my goodness. I'm obsessed with Pilates. Okay. I love Pilates. I had an accident where I broke my tibia and fibula and had surgery and got into Pilates, and I love it more than anything. It is like, yeah, can't say enough good things about it.
And if you couldn't be a sexologist, relationship coach, therapist, things like that, what would you be?
An accountant.
Really? Mm-hmm. I have never heard that before. Why?
I know, it's a strange thing. It's fascinating. I like that there's rules, but you're always trying to get out of those rules. I like that you learn all about people's businesses and how they run and what happens with them. And I just find it fascinating.
I think that's a much more glamorous viewpoint than the real life of an accountant. but thank you so much.
Yeah,
this has been so fun.
It's been wonderful. Thank you so much for having me.
Thank you guys so much for joining us on today's episode of the Rena Malik MD podcast. Make sure if you like this podcast, share it with someone who might benefit. And as always, remember to take care of yourself because you're worth it.